For years, Joe Chesa has made do without health insurance. Until his cafe went under, he didn't really need it. He'd always earned enough to pay his medical bills. Since times got tough, this former employer has found himself vulnerable to the slightest medical problem.
I don't know what I would do if something happened. There's just nothing left.
Joe isn't alone. 47 million Americans are in his shoes, without health insurance in a country where medical care is among the world's most expensive. But not everyone is for reforming the current system. These conservative activists have been monopolizing media coverage of the healthcare debate. Their argument? Publicly funded healthcare is quite simply anti-American.
No, I don't like big government. I'm an American. I'm independent. I want my freedom. I don't want the government taking care of me.
Under pressure from these opponents, Obama is scaling down planned reforms. Joe feels that the debate has gotten off track.
The majority of people that don't have health care are working people, just like me.
Newly out of work, Joe already has a future business underway, roasting his own coffee in this basement. Until his venture takes off, however, daily life is far from worry-free. A few months ago, Joe had chest pains. He worries about his heart, but a visit to the doctor is out of the question.
And I thought the last thing I need is to go to an ER. And I know if I tell them I have chest pains, there's going to be cardiac specialists and other people, and I'm going to end up walking out of here with a bill $10,000, $20,000. I don't have $10,000, $20,000, and I can't picture having a $10,000, $20,000 medical bill that I pay off a little bit every month for the rest of my life.
It is precisely this type of emergency room visit that Dr. Thaler hopes to prevent. As a general practitioner, he is a rare find in the U.S. Even more unusual, he makes house calls. By visiting his patients regularly, he helps them avoid costly visits to the ER that have contributed to the soaring health insurance prices. Dr. Thaler says that the priority should be to rebuild the base of physicians like him.
In the rest of the developed world, the primary care physician is the base of the healthcare system. And in America, that seems to be eroding. I think that the better that we take care of especially frail people in the community, and the more that we can avoid them going to the emergency department or being hospitalized, the more money that we can save.
Avoiding unnecessary trips to the hospital. For many in the medical profession, that's the key to making the U.S. healthcare system less expensive and therefore accessible to everyone.